Ladies and gentlemen, today we are going to discuss a very common disease of modern times. We always speak about coronary heart disease as the most common cause of death in civilized countries. As we all know, the lifespan in most of the civilized world is prolonged. And it comes now that the most common cause of death, in spite of that, remains to be coronary heart disease. To get an idea about the etiology of this important and dangerous disease, we shall say that it is not caused by one single factor, but it is produced by a multitude of different factors that cooperate together to produce what we usually refer to as atherosclerosis. This atherosclerosis means that there are certain patches in the lining of coronary blood vessels that develop rough and prominating areas in the lumen of the vessel, and these areas become later complicated by rupture or by thrombosis on top of them, occluding the coronary vessel, and so causing what we usually know as coronary heart disease. What is the cause of this atherosclerosis? Many factors predispose to the occurrence of atherosclerosis, such as smoking is a very important factor in this respect, and the incidence of coronary heart disease and the mortality from it are very common in smokers than non-smokers. Most of countries, of civilized countries, are now putting a good control upon smoking, but here in our country I feel that smoking is becoming more and more common, although we always speak about that and tell how smoking is so dangerous in this respect. Then we come to type of food. The type of food, foods that are rich in animal saturated fats, such as butter, fat of meat, fat of birds, liver, kidneys, all of these substances, eggs, contain a large amount of saturated fat. This is going to raise the amount of lipids, especially the low-density lipoproteins in plasma, and this leads to the development of atherosclerosis. Another important factor is the lack of exercise. Most of us lead a sedentary life. We never do an efficient enough exercise. It is advised that every person should do an exercise, a moderate type of exercise, for 20 minutes 3 times per week. This produces rather a good protection against coronary heart disease. Another important factor is other diseases such as hypertension and diabetes, and we have to make a good control of diabetes and hypertension so as to get protection against coronary heart disease. There are many factors, many other factors, but it seems that these are the most important factors that are capable of producing atherosclerosis, on top of which coronary heart disease takes place. How come that these factors lead to the development of atherosclerosis? It starts by an injury to the endothelium, which is the lining of coronary blood vessels. An insult to this endothelium is usually caused by hypertension, by smoking, by high level of blood sugar, by high level of LDL, that's the low density lipoprotein. When this endothelium gets injured, it becomes more permeable, and also it secretes materials that cause certain types of blood cells to adhere to the wall. The wall of the blood vessels becomes permeated by these cells and also permeated by low density fats. This leads to the development of deposition of fat in the vessel wall, fibrosis, and deposition of calcium as well, and this leads to the formation what we usually know as atheromatous plaques. These plaques, when they rupture or when they are complicated by thrombosis, occlude the coronary blood vessel and produce coronary heart disease. This is usually manifested by chest pain, such pain of certain site that's usually in the front of the chest, and it spreads transversely across the chest. It may spread to both arms, but more commonly to the left arm, to the mandible, and may spread also to the shoulders, and more commonly on the left side. This pain is usually of constricting or pressing or constricting or pressing nature. It radiates in the way I described. It may remain from 5 to 15 minutes in cases of angina, for a longer time in cases of myocardial infarction. In case of angina, it is produced by effort. In case of infarction, it occurs at rest. This pain in this way is usually very characteristic, and most of patients can recognize that this pain is related to heart, and they become greatly alarmed. When the doctor sees such a case, he is supposed to do a clinical exam and then investigate the condition by an electrocardiogram. In cases of suspicion, we may make a stress electrocardiogram. And echocardiography is also useful. And at the end, we may need to do cardiac catheterization to get a precise diagnosis of the condition. Cases of myocardial infarction should be transferred to hospital, should be transferred to the intensive care units. There are now very recent methods of intervention for treating these cases. Then we start by fibrinolytic therapy to dissolve the clot or the thrombosis which has taken place on top of the atheromatous plaque, so as to get revascularization, reopening of the occluded vessel, and protect the wall of the heart from being diseased or necrosed as a result of cut of its blood supply. In addition, we get anticoagulant therapy. There are also other lines of treatment, such as beta blockers and AC inhibitors, so as to diminish the damage which occurs to the wall of the heart as a result of this occlusion. Also, some cases will require to do cardiac catheterization. We all hear about dilatation by through the catheter, by angioplasty, by balloon dilatation, or applying a stent in some cases that require to keep the coronary vessel patent. This is a short review about coronary heart disease. Now we are going to discuss whether a patient with coronary heart disease can go for fasting in Ramadan, in the holy months of Ramadan, or this will be difficult for him. For the recent coronary heart attack, this needs a lot of care for the patient, lot of medicines, and lot of putting him at rest as possible. And we do not advise to keep fasting for the recent cases. For the older cases of coronary heart disease, the patient may be suitable for fasting in this holy month, but there are certain precautions for that. At first, he should not be exposed to dehydration, to deprivation of water and fluids in a severe way. If it is a hot month, he should keep away from the hot weather, avoid profuse sweating, so as to keep the water content of his body within a good range during the hours of fasting. The patient should not be deprived of fluids or dehydrated, because this may predispose him to a fall of blood pressure and to the occurrence of thrombosis. Perhaps disfortunately this year we have got Ramadan in a cold month, and so the danger of dehydration is not so evident as in the summer months, if Ramadan comes in summer. The second important thing is that the foods that he is going to take should not be related to our usual habits of taking very rich food. very high fat content. The food should be of low fat content, and you should avoid animal saturated fat as far as possible. Another important point is that by the time the fasting ends and the patient is allowed to take his food at the end of the day, he should not start by a very big meal, because this puts distending the stomach with a large volume of food and fluids will make a burden on the circulation and may precipitate a heart attack. He should start with a small meal, and perhaps it may help him to follow the usual manner which is being used by older persons in older times, that he should start by dates, because dates contain a large amount of sugar that stops his appetite and helps him to control himself and take rather a small meal at the time of ending of fasting. After that, he can compensate after that by taking another meal at the middle of the night. So he may take another meal at 11 or 12 o'clock, and then he can take a third meal by the time of start, before thus the start of fasting in the early morning. That means at about 4 o'clock in the morning. And in this way, he will distribute the burden of food and the fluids over 3 meals instead of 2. This will protecting him against overburdening his circulation, overburdening his body and his heart by large sudden meal at the end of fasting and another big meal in the early morning. Also, this is of importance for him to be able to take his medicines. The drugs are usually distributed on 3 meals, on 3 times per day. And we are always asked this question: how can I do that during fasting? You are asking me to take the drug 3 times. How can I do that with 2 meals? I advise this, and it is fortunately that this time in winter, the night is long. There are several hours at night that can allow him to distribute his food on 3 meals instead of 2. Perhaps fasting will be of benefit for some cardiac patients, for some heart patients, in a point that he may enable him to reduce his body weight, to get rid of his obesity. This is always beneficial in cases of heart disease. Perhaps this is a way for him to stop smoking. I know many smokers that fail to stop smoking in the usual months of the year, but they can do that easily during Ramadan months. And so this will be of great benefit to him. I repeat again that the cardiac patient should not imitate the other members of the family who take large amounts of salt in the food, large amount of pickles, because he has always to avoid fats and big amounts of salt in his food to avoid any heart complications. I hope for all of you a good month of fasting, of good religion, and also of good health. Thank you.